Hello, dear doctors, nurses, medical student, and healthcare team. How are you today? I hope you are well. Here we are going to explain another question about cardiology. A 48-year-old man has continuous anterior chest pain, which is worse on inspiration. 4 weeks ago, he had a myocardial infarction. The patient's chest pain is after MI, which the patient had 4 weeks ago. He has a temperature of 37.5 degrees Celsius. The patient is a little febrile. His blood results show an ESR or erythrocyte sedimentation rate of 82 mm per hour. His ESR is raised. What is the single most likely explanation for the abnormal investigation? We must look for the infective or any causes which can do this for the patient, rising the patient temperature or rising ESR. Okay, A. Pulmonary embolism. B. Cardiac tamponade. C. Atrial thrombus. B. Left ventricular aneurysm. E. Dressler syndrome. And the most likely cause we can see in the choices is Dressler syndrome. Now we are going to explain a little more about Dressler syndrome. Okay, Dressler syndrome tends to occur around 2 to 6 weeks following an MI. The underlying pathophysiology is thought to be an autoimmune reaction against antigenic proteins formed as the myocardium recovers. It is characterized by a combination of fever, pleuritic pain, pericardial effusion, and a raised ESR. As we can see in the patient's history, he has fever, he complains of pleuritic pain, and he has pericardial, and he has a raised ESR. Okay, and Dressler syndrome is also characterized by a combination of fever, pleuritic chest pain, pericardial effusion, and a raised ESR. The treatment of Dressler syndrome is usually with NSAIDs. As we said, it's autoimmune reaction against antigenic proteins. Okay, here we have an ECG which is showing Dressler syndrome. Okay, in Dressler syndrome, the ECG presentation is ST segment elevation, as we can see in this patient. In lead 1 we have ST segment elevation, also in lead 2 and other leads we can see ST segment elevation. T wave inversion, also we can see here T wave inversion, and PR segment depression, also we can see PR segment depression. If the patient is coming with fever, pleuritic pain, pericardial effusion, and raised ESR, while checking the patient's ECG, if we can see, especially if it's post-MI, it's usually 2 to 6 weeks post-MI, we can look at the patient's ECG. If we have ST segment elevation, T wave inversion, and PR segment depression, we can say that it's the Dressler syndrome, and the treatment, as we said, is with NSAID. This was a short explanation about patient coming with fever, pleuritic chest pain, and a raised ESR with the diagnosis of Dressler syndrome. Thank you for your attention.